I'd like to introduce you to Quaadgras, who is a friend and colleague of mine. She is the director of the MIT Sloan Initiative for Health Systems Innovation. She's going to talk to us about the initiative, tell us a little bit about the educational and research activities that are encompassed in the initiative. Her work focuses on health systems transformation and the role of information technology in that transformation, and her background is in information technology. Prior to her doctoral work, she was a management consultant for 15 years, specializing in improving decision-making and investment processes in the chemical, pharmaceutical, and financial services industry. She has a doctorate degree in information systems from Boston University. And Anna, would you please fill us in more on what the Initiative for Health Systems Innovation embraces? Thank you.
Thanks. Thanks, Jay. Yes, I would love to tell you a little bit more about HSI and education and our teaching. But first, I want to thank you all for coming today. It's been great fun to put this conference together and to work with OER and with all of you coming here. I'd like to point out we have a really diverse audience. How many of you are MIT alumni? Okay, that's a lot of that. How many of you are students or faculty at MIT? Got quite a few of those. So we think we had more this morning because one of the classes I co-teach, the rest of it I teach, is Healthcare Lab. And it is normally taught on Mondays and Wednesdays. And we gave the students the day off, provided they came to the conference. And I know that at least 20 of them signed up. So we're very, very pleased about that. How many of you work in the health industry? All right, so we got alumni, people who work in the health industry, people who are students or faculty, and maybe we have a few that fit multiple buckets. So that's really great, and we're really grateful that you're here. And I hope you're also having some good conversations in the breaks. But I'd like to spend a little bit of time talking about the teaching part. I mean, we've been talking all day about the research part of what HSI is doing, but we also do a lot of teaching. And we do teaching of students, but also we are working to develop programs for teaching of people in health delivery systems that want to transform health delivery systems. So that's what we're calling our Health Systems Academy. And we have actually gotten a wonderful seed funding philanthropic gift from Earl Yaffa to really get this going. It's something we've been thinking about for many years, and we are now starting to implement that to drive system transformation from the inside, working with leadership teams in community centers, community hospitals, to bring them together, to help them develop, the shared goals, the shared management language, shared implementation plans, and get them to work on actual projects that are mentored by MIT faculty. So this becomes a 2 or 3 day intensive learning experience for groups of practitioners to really start bringing together the ideas that are being raised here, the ideas being raised by our research, by Sloan faculty and others, and implemented in the real world and spread it around the world. So we really think that this will be one of the ways that we can shape and accelerate how systems are transforming. Another thing that we do is work with students. And we do that formally and informally. So MIT Sloan has really active students who get together and do a lot of things outside of class, one of which is the Student Healthcare Club, a really awesome organization. There's at least 100 Sloanies involved at any one time. And HSI works with them. We actually help sponsor their conference, which they asked me to put a plug in for, so here it is. So the Healthcare Club conference will be in March. It'll be great. Last year's conference was wonderful, and you'll be hearing more about it. It also includes MIT Hacking Medicine, as well as lots of speakers on key topics. So we work with them and help our students in this as they explore the health space. as well. Lastly, all of what we do is the healthcare certificate, and I know there was a little flyer about it down front, but the healthcare certificate is a set of courses that all MIT degree students can take, not just Sloanies. It includes undergrads, engineering students, doctoral students, and it really is a matter of taking several courses that give you this health systems perspective, this MIT perspective on healthcare. So it takes 3 required courses, only 3, one of which is on economics, one of which is medicine for managers and entrepreneurs, so taking really the entrepreneurial perspective on biomedical innovation, and one of which, my favorite personally, is Healthcare Lab, which is both an introduction to healthcare operations as well as an action learning project where students form teams and do projects with host companies in hospitals, in clinics, in startups, and in other health-related organizations, both for-profit and nonprofit, around Boston and around the US. And students also take some electives. So I could actually tell you about Healthcare Lab all day, but we have a movie that does it for us. And again, this has been funded by Dan Abrams, who's also been a very enthusiastic supporter of HSI. And so with that, I would like to, can I do this? Start the movie. It's a very short video. Let's see, do I have to start it or it happens magically, great.
HLab is a unique course in various ways. The people that take it usually have a lot of passion, a lot of vibrant spirit about desire to somehow affect this industry and make it better.
It's a course that really is all-inclusive of the myriad of complexities of healthcare.
I'm a physician, and what I wanted to do when I came to Sloan was to learn more about capitalism and business practices and the business of medicine. A lot of the people that come to HLab come from the other direction. They know a lot about business, but not about healthcare. And it's a meeting in the middle. It's the beginning of a journey for both those populations.
We've had undergraduate students in the class. We have MBA students, PhD students in operations research, mechanical engineering, electrical engineering, biology. We have Sloan fellows, so executive MBA programs, people that within their organizations, they may already be an executive.
That diversity of thought really pushes you to think differently.
The students work in teams with a host organization to solve a real problem that matters to the organization, that has impact, and that the senior leaders in the organization care about.
Working with the students allowed us to have a think tank where we could say, we're really wrestling with this issue around care management teams. Can you help us to find examples of highly effective care management teams? And the students would take these questions that we were wrestling with and go off and do the research.
I worked with CVS, and so we got to meet personnel, we got to interview people, we got to really have access to a wide range, top to bottom. We were working with Minute Clinics, so we actually got to go and meet Minute Clinic providers.
We did a project for MIT Medical. They wanted help with how they handle referral management.
It could be a very large organization like the Massachusetts General Hospital, or startups, as in my case, that are developing disruptive technologies.
It was very pleasing to hear that something that we worked on as a team, just as students, was able to implement real-world change in the hospital.
The poster session is always a fun day because you just kind of get to celebrate the work that you did all semester and see what your classmates were up to.
Once we secure our funding, we're gonna go back after those students because it was a nice way for us to test the students on a project basis and figure out what their capabilities are.
I have clarity now that my future is at the intersection of healthcare and technology, and I think the Healthcare Lab has given me both the knowledge and the connections that are required to make that happen.
We're already starting to see these students that graduate from the course going into key positions in the health innovation space or healthcare delivery systems.
Transforming health systems is a monumental challenge, but we have to keep working at it. We have to succeed. It is one of the key challenges of our world, of our time. So I really couldn't have said it better today. But I would like to make one request, that if you are from industry or an organization and you would like to have your own healthcare lab project, to please contact me, because while healthcare lab is going on right now, we'll be doing it all again next year. And so we're starting to think about new host organizations and about getting together. My email. Actually, it's in the program. But it's aquad@mit.edu, so my first part of my last name, with all the A's in the right places. But yeah, and also, of course, I'm here the rest of the day and happy to talk about any of these things. At this point, are there any questions from the audience that I can answer about what we're doing here at HSI? I think we're ready for an afternoon break. That's what it is. Thank you all.
I'd like to vouch for the HLab students. As I mentioned to you earlier, I'm on the board of directors of a community hospital on Long Island, and we had 3 students from the HLab class spend a good part of last year in Southampton, New York in the winter, not during the summer. And they helped us address a complex set of issues having to do with throughput in our emergency department. And I will tell you that the analytical approach that these 3 grad students took was incredible. And the director of nursing service said to me that one of the students was like a dog with a bone, that she wouldn't let go of the analytical piece of this until she really had clarity about the solution to the problem. And they did help us to solve a problem having to do with patients who present at the emergency department and then are admitted to the hospital. We were handling the other patients very effectively, but we didn't handle particularly effectively those patients that were admitted to the hospital. So it was score 1 for Southampton Hospital, score 3 for HLab students.